some of our biggest challenges are around just processing the ever-increasing amounts of data we have. So although the clinical data set is quite big, when you add the genomics, proteomics, wearable data to that, you start getting a big problem with just the capability of handling that amount of information, but also the analytics that go with that. So one of the big challenges is to understand how do we analyse such large data sets in a meaningful way and in a time frame that's appropriate, because if we're doing adverse event reporting in real time, we need to be able to analyse things very quickly. So those are some of the biggest technical challenges we're going to face.
In terms of technology solutions that would be required, I think one can divide that into several different areas. The first is actually technology to undertake the genomics, and that is advancing all the time, but actually having it available at clinical grade and clinically acceptable is going to be very important. And the second challenge is actually providing the information to practicing clinicians, and that requires the availability of decision support tools incorporated within the electronic medical records and electronic prescribing records. There are also regulatory challenges as well in terms of what is going to be acceptable to regulators before it is actually implemented into healthcare practice.
The sequencing now is really just a technical exercise, and that includes the mapping and variant calling. It's the clinical interpretation that really is the skill, and so this is where we're going to be putting our efforts. Another area that is really important is we want to do very rapid interpretation of genomes, and so for example we would like to be sequencing and interpreting genomes in 2 to 5 days, and at present we don't have the capability for doing things quite that quickly.